So, back to the original topic. We are what we eat. And so, kind of show two different pictures here. And on this side, they are connecting, obviously the lady's kind of overweight with this kinds of food, which happens a lot of times. There's not a guarantee that it happens. The bigger problem with the processed foods has to do with some of those list of chemicals and things that I was talking about earlier. Not only is it the sugars, but you also, in processed foods, that's why they came up with a lot of those chemicals, was for the preservation process and to make things have shelf life, so you could stick it on the shelf and it would stick there for years and years, so you could sell it, now, or you could sell it 2 years from now and still make your money on it. And so that's why these things are starting to, we're realizing are so bad for us. This is the average American's diet. So about 40% of our diet, look at this, 600 pounds a year. This is based on a year. 600 pounds a year comes from dairy products, which in its own is insane. And actually, this is something I work with a lot of my clients with. Sometimes you have to reassess your own diet journal. If there's a question, if you think you're not eating right, or if you're wondering if you're not eating right, or if that might be a question, the first thing I'll tell you is keep a journal, like a food journal, and write down simply, what am I eating over this week, and actually be totally honest and actually record everything that you do eat, and then go back and look at it, and you'll probably realize what the heck was going on. Because this is what happens with my clients in here. We look at it and we come back and realize that these averages are actually spot on. People between milk itself, cheese, ice cream, sour cream. I'm kind of throw butter into that mix, but between all those things, also people realize, hey, about 30 to 40% of my diet really is cheese, which is crazy, or dairy from that one source. And so the problem with that is as most people here know, I'm not a big fan of dairy, but the bigger problem here isn't so much whether I'm okay with dairy or not okay with dairy. It's more that every food only gives you a certain nutritious value. So if you only eat the same food over and over and over again, there's only a certain things part of your nutritional intake that you're getting. And from dairy, it's not much. So if 40% of our diets is from that. And look at the other ones too. Sugar is a really big problem now too, because, and we're going to go into sugar a little bit more, and dairy actually, because sugar, they're now estimated about 22 teaspoons. Average American eats 22 teaspoons of sugar a day, which equals out to, what does that say? 141 pounds of sugar in a year, and that's actually not including corn syrup, which they're saying is another 42 pounds. So it's just nuts. That's just nuts. So sugar, again, same concept. Sugar isn't necessarily bad. There are some people who stand up and tell you, never, ever eat sugar. It will kill you. We need some form of caloric intake. Sugar has a tendency to be a really good source of that. It's just, we're talking small amounts. So, small amounts of sugar, it's going to be fine. Now, if you come to me and you're type 2 diabetic and there's all these sugar problems, we're going to have to assess it in a different way. But in a general rule, a little bit of sugar isn't a horrible problem. The better source of it is things like maple syrup, honey, things like that. So, back to the gut. So, bring it back. So, we are going to go into a little bit of the basic physiology of how our intestines work. And I do this to give an understanding, kind of the education, the background of realizing what's kind of going on inside of us. So our actual intestinal tract is consistent of our esophagus, which comes down after you eat something that goes into the stomach. The stomach then dumps into our small intestines, which is all of this in here. And once it goes through this whole process, and this is actually where most of your absorption happens, is in the small intestines. And actually right here, there's a little valve that goes between the small and the large. It dumps into the large intestines, which takes it up, over, down, and then it's gone. So the actual small intestines, that's what we're looking at here. So here's around, you're looking through the inside of it. The way that absorption works, so when we eat food, our body starts to break it down into really, really small compounds. We know mostly we have vitamins, we have minerals, we have proteins, and they're on a very, very small level. And so then once that happens in the stomach and the beginning of the small intestines, it then goes into the latter half of the large and small intestines, and you actually start, to absorb it. And the way that that works is right here. So inside you have all these little like finger things, and there's actually a blood flow that runs into those. So this has to open up, and it lets the right chemicals, the right vitamins, minerals, and stuff in, and it'll actually go straight into the blood supply, and then your blood then pumps out the rest of your body. This becomes a problem with, again, if you look at how things can actually get into our system, this does become a problem. Our body, for the most part, knows what things to let in and what things to just let pass through. So there's definitely parts of food that we just let pass through, like the fiber and things like that, that you don't actually digest or bring in, absorb into your body. This is where the problem comes with that list of different chemicals we talked about in the get-go. Because they are chemicals that we are creating, they're not chemicals that our body is used to seeing. So our body, for the most part, does not know what to do with it. Default often becomes let it come pass through, which is ultimately not good. But that's the way that most of these things enter into our system. And they're things that build up over time. If we gave you like an immediate dose of like, here, eat this pesticide-filled apple, like you're not going to see a bad effect from it. Over time, yes, you will. So another thing that happens on the inside is that, and this is where the allergy part comes in. So if you eat a lot of food that doesn't have, so fiber is an important part of our diet because fiber is what actually, again, like pushes things through your intestines or helps them move through the things that aren't supposed to stick around. Things without fiber, i.e. processed foods like breads, things like that, have very low fiber intake, particularly flour, so whole grains actually have a lot of fiber to them. When you process them and make them more like flour, things like that, you lose the fiber aspect to them. And this stuff starts to build up inside of our intestinal wall. So this is the same thing, those little finger things, but now they're being covered up, and you're like, and then you have a problem with absorption. So like the very thing that your body needs, the vitamins and minerals to get rid of this stuff, and now no longer has access to it. And this becomes a perfect place for bad bacteria and then things like mold and like funguses to start actually really developing. And this is where a common thing that people, candida is a concept that a lot of people have heard about now. It kind of got looked at for a while like a cure-all, like we can just get candida under control, then you're good to go. That, a lot of times, actually is almost the case. But what candida is your gut has natural bacteria in it. Candida is one of those because the bacteria is what actually breaks down the food. The question is, what's the ratio of these different types of bacteria? So if we have millions of bacteria inside of us. So you want it to keep it that way, like a million different types of bacteria. When you get into a scenario like this, the ones that thrive are the more like fungus type ones because they don't need oxygen and stuff, which candida is one of those. So this is an environment where things like candida or yeast can thrive. So if I find people that have pretty consistent stomach issues, like when they eat foods, they feel like get really bad or like throw up, like more like the bloating, like people after they eat, they feel like it's like almost a guarantee that this is going on and that there actually is a candida issue. Across the board, both men and women, like UTI, people have constant UTI infections, things like that. That tells you the same thing. It is the same bacteria, that Candida albicans is the name of the bacteria that will cause UTIs in this. Eventually, because of this relationship, it's showing here, the bad bacteria will actually start to eat away at these. Because of this relationship with the proximity of the blood supply, that yeast can actually start to spread. And that too is being found as a common reason for things like cancer and stuff like we started out in the beginning. So that yeast can definitely spread out to other areas. This is actually a pretty big concern. This is one of the concerns with using antibiotics. Most doctors now, hopefully, cross your fingers, at least it's in the literature and the research. If you do have to use an antibiotic, you need to follow it up with what we call probiotics, which is good types of bacteria. You can do it in a supplement. I have a list later on that's like natural foods that will give you probiotics. But you've got to follow it up with that because one of the quickest bacteria to bounce back is the Candida and that particular bacteria. And so after a round of antibiotics, a lot of people have seen this happen. Like sometimes, I don't know if you ever know, so after a round of antibiotic, their tongue will get white. And that's because that is showing that that yeast or that Candida has overgrown. It's actually now made it out to the tongue. You'll also see UTIs follow antibiotics pretty often as well, and this is why. So this scenario also, okay. This scenario is also what ends up leading to food allergies. So in my clinic, a common thing I'll tell people, so you have a thing, food allergies, and you also have food sensitivities. So like a food allergy is like an actual allergy. You eat a peanut, your mouth blows up, like like anaphylactic shock kind of concept. That is what we know as an allergy. A sensitivity will often come on. It's usually a less extreme reaction, but it is a reaction nonetheless. And it will usually come on because of this scenario. If this is going on, then your body can't process certain foods like it's supposed to. So if you're not being able to break down certain foods, well, then your body starts reacting to those foods. So real quick, prevalence, IBS, which is irritable bowel syndrome, actually is as many as 20% of all adults in the United States. So 1 in 5 Americans have it. Irritable bowel disease, it is estimated that as many as 1.4 million persons in the United States have it. And then GERD, which is acid reflux, a form of acid reflux, 1 out of 5 people experience heartburn or regurgitation on a weekly basis. 2 out of 5 people experience heartburn or acid regurgitation at least once a month. All of these things are a sign that this is what's going on. This is what's actually going on for any of those cases. The question then becomes, how do you actually treat that? So allergies, that's what I was talking about a second about allergies versus food. I will use the term intolerance or sensitivity. And that's the reason why, because we do make a bit of a distinction. It's actually, not to go too specific, but your immune system actually has 2 different cells that will react to food allergies. And one is what we call IgE, which results in the anaphylactic type shock. The other one is IgG, which actually results in other types of allergic reactions. Which can cause, usually it causes inflammation internally, so you see more of like stomach problems, like the GERD, the regurgitation, that kind of stuff, or the acid problems. This is reasons why you'll see headaches, migraines, even back pain, neck pain, all that stuff can definitely come from it, because what it does is it starts to amplify inflammation internally. And that is what we actually officially call a sensitivity or an intolerance to a food, as opposed to an actual allergic reaction. Symptoms, here's just a couple of symptoms of what we call a typical sensitivity or intolerance. If anyone comes into my clinic and says that they are experiencing any of these, I immediately do kind of my testing for different major food sensitivities. So headaches, fatigue, brain fog, difficulty concentrating, asthma, arthritis, urinary infections, vaginal prostate, inability to lose weight, chemical sensitivities, chronic pain, multiple sclerosis, high cholesterol, heart conditions, diabetes, insomnia. And this sometimes can be kind of a hard thing. I actually threw it back up. Cool. This can be kind of a hard thing to work with sometimes, because we are definitely used to eating a certain way. And usually the foods that as anyone here that's worked with me can testify, usually the foods, if you come into me and you think about the top 5 foods that you love to eat, chances are that's the top 5 foods I'm going to tell you not to eat. The more we eat these things, the more our body has time and ability to react to them. And again, it comes from diversity a little bit, and your diet definitely does help, changing it up. And even what I'll normally do, and I think I actually have it on the next slide. There we go. So there's a little threefold phase to fixing this problem. I'll say that I'll start by saying it works. It does work. I've done this with numerous patients, and it absolutely does work. Does it necessarily work the first time? I'm not going to guarantee that. Do sometimes we go through this whole little process, and then we realize, like, 50% of the problems went away, but not all of the problems. Yes, and we kind of come back and reevaluate and go through it again. I haven't had too many people have to go more than kind of twice through this little system of figuring out what your foods are, what we need to take out. And again, as some of the people here, again, I don't want to put anyone on the spot, but they could probably testify to the fact that the neat thing about it is 4 or 5, 6 months, and that sounds like a long time, but it's really not. 4, 5, 6 months later, you have a better ability to deal with some of the foods that you were sensitive to before. It's not like you will never again eat gluten or you will never again eat dairy. It's that once you get things calmed down, like your body starts to be able to deal with it a little bit more, and you kind of be able to figure it out. Like you start to realize if I have 1 piece of bread in a day, I'm good to go. If I have 2, it kind of blows me out, and I can feel the difference. So the first of this little threefold phase here is remove. So identify food allergies and remove them from your diet. This one is what I actually do here in clinic with a process called muscle testing. That's one of the reasons why. That's why I am certified in applied kinesiology, which is the instructing and teaching of how to do muscle testing, to even test for different things like food allergies, food sensitivities. I have, and forget for those that work with me, I have little different vials with different foods in them, and we go through and we kind of check these different foods to figure out which ones we need to take you off for a time. It's an extremely helpful tool. To be honest, the biggest thing that tells me we got it right is actually when they come off those certain foods, you'll see these reactions and stuff go away. And so that is kind of the defining, between that muscle test and the actual results are kind of the defining of that we found the right foods. Identify the exposures to molds and funguses, same thing, and the bacterial infections. I do go through checks as well, different molds, funguses, bacteria, viral type infections. They are what we call subclinical mold, fungus, bacteria, and viral subclinical infections. If we actually ran a stool sample, you would see them. If we looked at person's symptomatology, like are they running a fever, are they clammy, are they sick, you're not going to see them. But if we ran that stool sample, you would actually see them show up. For the parasites as well. It's actually estimated 1 in every 2 Americans has an issue with parasites. So split this room in half, and there you go. Which is just not something we think about much. We usually think third world. We think that's crazy. We also think of the giant, 6-foot-long parasites. But we're kind of exposed to them more than we realize. If they're on a small level, what they do is they, unfortunately, these what we call subclinical infections, they wear out our immune system on a daily basis. Because while we're not conscious of it, our body's dealing with these things. So then the next winter rolls around, you get exposed to somebody that has the flu, and your immune system should be apt to deal with that. But what it turns out is that because of all these other things going on, you get sick, and you're not able to deal with it. And so if anybody, I have used this since my entire time being a doctor, and the muscle testing, I trained with some of the best doctors to be honest, in the world that do it. It is a technique that started back in the 1980s, and it's since flourished. It's actually used. It was originated in chiropractic, but moved over to both the medical field and the psychiatric field. It is used in both those areas as well. But if someone ever wants to do more testing, again, I do have access to the stool samples, different things like that we can do if someone wants to know more in depth or wants to verify in a second way. So, and then the last one is identify proper herbs and nutrition to kill off the yeast or these different infections that we're talking about. So, a lot of people don't realize that all modern medicine actually originates from herbs. Before modern medicine came around, herbs is what people used to treat and fix people. one of the amazing things now about the fact that we have like a worldwide economy and like communication is that we're actually able to pull some of the best used herbs from across the whole world. Like we're not having to just rely on what's here. And I firmly actually do believe even what's here around you will get you through it. It's just a matter of how much time and how much is it going to take. By having access to some of the more potent ones from across the world, we can do things a lot faster a lot of times. And so one of my companies, actually it's cool, I'm here, I get to point to it. These ones here are the ones that look kind of hippie-ish. It's actually, the whole company is dedicated to that very fact of kind of researching, see what research there is out there on certain herbs. That's another thing that's actually like a myth, is a lot of people believe that there's not research behind herbs, like it's still more of just a, like an interperson, this might be a good plan, my grandmother somewhere down the road told me it was a good idea. There is actually, on more of the prominent herbs, there's actually very extensive research on their abilities, what they can work with, what they can deal with, and their effectiveness against some of these things. And they actually, most of them, time and time again, have been proven to be more effective than their counterpart medication, because herbs are, I don't know how much this will make sense, but herbs are an entire complex. So like it's a whole, we have a whole, like the herb, like the leaf, whatever it is, and like everything that's in it. And so it's not just like one vitamin, it's not just vitamin C, it's not just vitamin D, it's everything that's in there, which is usually all the above. Medication is actually taking, like anti-inflammatories is the best example. They realized like this herb had an anti-inflammatory property, so they said what specific compound in that herb did that one step of stopping inflammation. And so then they find that, pull it out, patent it, and they produce a medication. Well, the problem is the herb also had everything else in it that was good for you. And so if you give just this anti-inflammatory component, there's side effects to that. And we're pretty aware that most medications have major side effects. If you go back and you actually give the herb complex itself, you don't have the side effects because it has everything else in it that would have, like, to balance out what else is going on. That's one of the great things about herbs. So muscle testing is also the way that I figured that out. But as a general whole, the two pieces of nutrition that I give almost to everyone that are dealing with this problem are these two products here. One is called Takasumi, which is actually a charcoalized bamboo coming out of Asia. So they take, it's literally what it sounds like. They take bamboo, charcoalize it. If any of you have ever worked in the, if you ever haven't, but so actually, if someone over intoxicates themselves and they end up in the ER, the first thing they'll do is they'll pump them full of charcoal. They'll give them charcoal because it actually acts as an absorbent and will prevent that alcohol from hitting their blood in as high of levels as it would have. And then they actually have to pump that out of them. But with this, it's the same similar concept. So I'm able to give this activated charcoal that actually acts as an absorber. So you take it in small amounts with water, with liquid, and you drink it down, and it'll actually start to absorb and break down that crud that we saw from that picture that will build up inside of our intestines. It usually will help people go more frequently, which is always a good thing, as well as get rid of some of these toxins. The other part of this step is a product that I've actually recently, in the past like few months, become exposed to. It is a complete set of minerals. So whether you are someone that believes in creationism or someone that believes in evolution, both categories realize and accept the fact that we come from this earth. Like, we developed from things of this earth. And the actual things of this earth, like the ground and stuff, is minerals. I mean, that's what it's full of, is minerals. The building blocks, you could almost say, of our bodies in a big way are minerals. And so having enough is extremely important. There's a lot of reasons why we are deficient nowadays in minerals. And so actually just a simple full like mineral compound as a liquid form over a long enough period of time can make huge, huge changes. And it actually has, those different minerals are what your body needs to break down and fight off some of these infections and different things like that. So Next one is replace. Actually, yeah. So this is all about diet. So replace, and that's the concept of nutrition. Give your body what it needs back so that this doesn't happen again. So proper fats, proper proteins, proper vitamins, proper minerals. I do have another health talk on a different date talking about what to eat, what not to eat. So I'm not going to go into details here, but the concept with this is most of us almost innately know. Like if I really sit down with someone and say, what do you think you should be eating? Like usually they're able to pop out, some pretty good ideas. Well, go with that. Just go with that. So, I mean, if you really look at it, the idea is stay away from the processed foods. Go back to like the real, what I would call real foods. And if you do that, you're headed in the right direction with making sure you get minerals and vitamin content. Repopulate. This is extremely important. This has to do with making sure you get the right bacteria in your intestines again after it has been kind of wiped out. I put up here a list of natural ways to find that sauerkraut. With sauerkraut, real quick, these three here. So sauerkraut, kombucha, kimchi. The idea is that it is actually something, oh my gosh, what's the word? Not pickled, fermented.
Fermented.
Culination, fermented. It happens in the pickling process as well. Because, interestingly enough, all living things actually have, like all plants, have bacteria on them as well. And they actually have good bacteria. Oddly enough, it correlates with the bacteria we have in our gut. And so when you take that and you actually take it and you pickle it or you ferment it, it allows, that's what actually is happening is those good bacteria are what's thriving and developing, which causes the fermentation and pickling process. So then we take it and we eat it and we like fill ourselves with this good bacteria. Natural forms are more potent. There's no doubt. Like one serving of sauerkraut is actually going to give you almost as much probiotics as you'll buy in a container of probiotics. So there's really no doubt on that it's more powerful. Some people don't like that stuff at all, as I'm seeing a face right here. So there is a need for supplementation with probiotics. The other thing, too, with supplementation is we are able to get a wider bacteria base, but you will definitely be fine with just the natural forms if you want to shoot for it that way. And so that's another thing. We do have probiotics here that we carry. I do try to push people in this direction because it's hard to, again, if you look throughout every culture, I guess in the United States we have pickles. Like maybe that's our I don't know. But if you look back through like every culture, you'll see different major foods that were fermented. Like sauerkraut is German. It was a commonly eaten food in Germany. Kimchi from Asia, and it's still a commonly eaten food in Asia. The point is we actually need these on a regular basis. This is a repopulate for life process.